Thank you for the introduction. I have nothing to disclose. So this is a patient with a graft failure 6 years after Dmek for Fuchs, and this video shows how the idea came up for the study. So if you, this is my own experience, if you have a late graft failure like here, then it's very difficult to find a plane to remove the old graft. It seems like there is a very strong adhesion there. So usually for removing the Dmek membrane, I need less than a minute. In this case, it took me about 10 minutes to remove this old graft, and I also used some forceps like you see here. So to address this issue, we looked at our charts. So we had between 2014 and 2023, we did about 6,000 Dmek surgeries. About 95% of those were primary Dmek surgeries, and about 200 were repeat Dmek surgeries. So this is our study group. 52 eyes had a repeat Dmek surgery of more than 5 years after the primary Dmek surgery. So as I said, we had 52 eyes included in this study, having a graft failure of more than 5 years after the primary Dmek. The mean interval between the primary Dmek and the graft failure was about 81 months, about 7 years. And then we did some transmission electron microscopy, and we also did some immunohistochemistry. Here are the results. First of all, the clinical data. For this clinical data, we separated 3 groups. So the first group is the early, of less than 2 years, less than 24 months. The intermediate failure is between 2 and 4 years, and after that, we called it a late failure. So the most impressive finding here is what is already known is that glaucoma is a main risk factor, but it is the main risk factor for the intermediate failure, not for the early failure, and this was the only thing that was statistically significant. And this applies to glaucoma patients with or without having some surgery, like a tube or a trabeculectomy. Concerning our findings of the transmission electron microscopy, here first you see a control, a healthy eye, and here you see an explanted graft 85 months after Dmek. So the first finding concerning the back surface, the posterior surface of the Dmek membrane is a thick posterior collagenous layer, like we see it in pseudophakic bullous keratopathy. And 19 out of 20 Dmek membrane specimens had this very prominent posterior fibrillar collagenous layer, and we can also see some few fibroblasts-like endothelial cells. So the next thing is the anterior surface of the Dmek membrane, and it is this interfacial matrix zone. On the left side, you see again a control, a healthy cornea. On the right side, the explanted grafts. Here it was 92 months after the initial Dmek. And here we also see a thick interfacial matrix zone, but we also see a lot of irregularities like ruptures or focal adhesions of stromal collagen fibers, and this is indicative of a strong adhesion of the graft to the host stroma. And this was also the thickness of the interfacial matrix zone was also statistically significant. Here we also can see some more details. On the left side again, the control cornea, the healthy cornea, and on the right side, 20 out of 20 specimens we did examine, so all of them had those anterior surface irregularities and ruptures. We don't see on a healthy cornea. And here we also see some focal adhesions of stromal collagen fibers. So about half of our patients had additionally to these irregularities some stromal collagen fibers, which also shows that there is a strong adhesion between the graft and the host stroma. One eye or one specimen even had a whole stromal collagen lamella to the interfacial matrix zone, as you can see on both slides, but the right one is a higher magnification of this decimate membrane. Concerning the immunohistochemistry, you see some labeling. On the left side again, you will see the control cornea, the healthy cornea. On the right side, you see the explanted grafts. And those are some adhesive glycoproteins like fibronectin, vitronectin, TGF-beta induced, and amyloid P. And you will see that on the right side you have some increased labeling intensity of these adhesive glycoproteins. We also did some analysis, statistical analysis, and you can see for all four glycoproteins, fibronectin, vitronectin, TGF-beta induced, and amyloid, if we compare it to the controls, there is a statistically significant increased labeling intensity for these adhesive glycoproteins, which are found along the interfacial matrix zone. So in conclusion, concerning these late graft failures after Dmek, in transmission electron microscopy of those explanted grafts, we saw signs of strong adhesion to the stroma, like the prominent interfacial matrix zone, and most importantly, the anterior surface irregularities, some ruptures, and even focal adhesions of stromal collagen fibers. Concerning the immunohistochemistry, we saw some increased labeling intensity for adhesive glycoproteins along the interfacial matrix zone, including fibronectin, vitronectin, amyloid P, and TGF-beta induced. So these findings confirm the firm anatomical reconstitution of the posterior cornea after Dmek surgery.